Assalamu alaikum wa rahmatullahi wa barakatuh. You are listening to the Mara Mukwanda Show on Salam Media. This is the Thursday edition. Thank you for joining me. Coming up on the show today, I'm going to be chatting to Dr. Elena Moore, who is an associate professor at the University of Cape Town, who is currently working on a project on intergenerational relationships in South Africa, which is a study of family responsibilities and obligations. So that will be coming up shortly. At 11:35, I'm going to be chatting to author and journalist Aisha Dadi Patel, and we are discussing generational equality under the theme Realizing Women's Rights for an Equal Future. We do know that it is Women's Month, and during the weekend it will be Women's Day. So why not have these discussions regarding women as well as generational equality in South Africa? At 12, I'm going to be talking to the acting head of Sandparks Communications and General Manager, Reynold Takuli, because most of the national parks will be reopening next Friday. And some of you are excited about that because now you can finally go out and get some nature and just be with the animals and be with nature, be in touch, because you missed that because of the lockdown. But good news is on its way, and that will be coming up at 12. And we end off the show chatting to our dietitian, Moloko Mehlabe, about sugar addiction. Is it possible to quit sugar? That will be at 12:35. If you have any comments, questions, queries, or suggestions, do send them to us on WhatsApp. The number is 061 766 Alternatively, you can leave them in the comment section on our social media pages. Follow us on Facebook, Twitter, and Instagram. Do stay with us after the break. I'll be joined by Dr. Elena.
With over 80 years of experience, IG Refinement Company are renowned for their quality Islamic ware and goods. IG Refinement Company stock a variety of Islamic items, with salons, kebabs, perfumes, and exclusive gifts. We guarantee you a unique and holiday shopping experience for the entire family. Visit our new branch in Silverpark at 202 Kenilworth Park, Westfield Road. Open 7 days a week with super fast food meals for Instagram at IG Refinement for our latest promotions and updates. IG Refinement Company. Yes, many great stores. You're listening to the Mariam Quimbo Show, Monday, Wednesday, 11 a.m. to 1 p.m. You're listening to the Mariam Quimbo Show, Monday, Wednesday, 11 a.m. to 1 p.m.
Welcome back. You're listening to the Mara Mukwanda Show on Salam Media. And joining me on the line right now is Dr. Elena Moore. She is an associate professor at the University of Cape Town, a sociologist specializing in the sociology of the family, and also has a master's degree in applied social research and a PhD from Trinity College in Dublin. And as I mentioned earlier, she is working on a project on intergenerational relationships in South Africa, a study of family responsibilities and obligations. Dr. Elena, good morning, and thank you for joining me.
Good morning, Mariam, and thanks for having me. And hi to all the listeners. It's good to be here.
It's a pleasure to have you. All right, so women have always been at the forefront, taking care of their households, taking care of everyone in the families. And now with the pandemic, that has not changed, but it has added
Mm.
on some more challenges to the challenges that they had already had. So let's
Mm.
start first with the first article in the series that looks at the challenges in the old age grant receiving households. Um, you said that there is the reliance on the old age grant is, and it's set to increase with the extended lockdown. So have we
Mm.
already seen these increases with the extended lockdown?
Yes, so well, yes, there has been a 250 rand increase in old age grant, in the sum of the old age grant. Um, and as we know, the old age grant is one of the highest paying in terms of, the value in South Africa, as and we also know that it's paid out to over 3 million older persons. Now, in that article, what I'm trying to do with the three-part series is break down the concept of multi-generational household and like describe different types of multi-generational household. And the concern I have in particular when we speak about um, older person headed households, or old age grant receiving households, is that first of all they make up a huge portion of the population, but they rely quite heavily on the old age grant. So we know that 9 out of 10 older persons in South Africa receive that grant. And if you think about it, about 4.5 million people are older persons. So there's a huge sum of, roughly 3 million old age grants are given out across the country. So that's a big portion of the population. And given the value of it, it's a key source of income. So, studies have shown us that 80% of households headed by an older person indicated that the grant is the main source of income. Now, it has, as you rightly say, it has been increased by 250 rand, which is whatever, approximately, 12, 13% between the May and October period. And I suppose in that article, what I allude
Network is
to,
leaving me.
okay, did you get that?
Sorry, I apologize about my network. It's a bit of windy out here, so it's giving me a problem.
No
Sorry
worries.
about that. Please continue.
Yeah, no, so I was just saying that I'm not sure if you caught that, but I was saying that not only is the value higher and significant, it's also highly significant because studies have shown that about 80% of households headed by older persons indicate that the old age grant is the main source of income, which shows you how reliant older persons and their households are. So if we think of that on the one hand, we think of the number of children that are cared for, not just other adults, but also children that are cared for by grandparents who are grandparents or great grandparents that are receiving the OAG, as we call it. There's basically about 2.7 million children that live with grandparents without parents. And over 7 million children live in households where the household head is a grandparent, albeit some of those grandparents may not be over 60 and may not be receiving the old age grant. So we've seen a 250 rand increase in the grant. What I allude to and I would be concerned about is that we know that older persons are more vulnerable to illness should they catch the virus. And we've seen now in the last couple of weeks, at the beginning, we weren't sure, how the virus was going to play out, how it would impact different households, different people. But where we're currently at is we've seen over 9,000 deaths across the country. And that's, they tell us that that's set to continue for a while. And I recently looked at this, and I looked at 2/3 of those deaths are for people between 50 and 79. So over 60-year-olds, so that's, are representing a huge portion of the people who are passing away because of this virus. But we also have found out recently that there's a significant sum of a number of people who have passed away in what they call as excess deaths. And that represent, there was about 17,000. We heard from the Medical Research Council, a recent report between the periods of May and June, that over 17,000 people, have said to die in what's categorized as excess deaths, which are assumed to be linked to COVID-19 quite significantly. And around 11,000 of those deaths were people over 60. And so what I'm saying is, whilst the increase in the old age grant is applaudable and, is welcomed by all, we're not sure what's happening with particularly the old age grant receiving households when an older person passes away, and the lapse in time between and basically the loss of that significant income in the household. And that's something I think we need to be quite concerned with as the number of deaths increase. And so in that article, that's what I was trying to allude to, the vulnerabilities for others, specifically the older person, for the household though more broadly.
And when you look at the situation in South Africa, many of the households are headed by older persons, which makes it difficult for the next generation. I mean, even if the majority is the old age households, because sometimes parents need to leave their kids there so that they can go to work, and when they go to work, they also are vulnerable in the workspace. If they aren't able to take leave, and coming back home, they bring in the virus, and it's just an entire circle that is going around. And to make matters worse, also is living conditions. If they're living in informal settlements, and that will also just make the virus increase even more. Now,
I should say in that respect, I mean, exactly what you're pointing to is that a number of the participants in the study are nurses. And nurses and teachers. And there are two categories of occupations that are exposed, potentially more exposed to COVID-19. I think we would agree with that, specifically nurses. And some of the research findings that are coming back is that, nurses who get infected obviously have to isolate, and are often isolating away from their household, so in a different place, and therefore they need to organize care for the younger members of their household in ways that might and often incur an extra cost, specifically if they have to rely on a childminder or someone else to cover that care. So that's also, so it's the fear of contracting the illness and bringing it back to family members, but also the cost in when that happens. Who pays for that care for the younger to look after either younger persons or older persons in the household?
And where are the men in all of this thing? Yeah, but in your third paper, you've spoken about, you touched base on an example of one man in there, but his example is different from the many men who are really not there in some of the African households. So where are they? Where are these men?
So you're probably aware there was a large representative survey conducted recently based on the NIDS-CRAM survey. The report came out about 2 weeks ago, and there one of the interesting findings that I found particularly was it showed that 17% of men are now living back in households with their children or with children. So we probably see during this period of lockdown where people are kind of sheltering where there is security, whatever that means for the person themselves, whether it's financial or physical security. We're seeing in these findings a move of men moving back into households where there are children. So the finding shows that from this particular large survey that whilst women were spending, more amounts of time on care, men too were spending, I think it was 65% more time. Now, when we think about it, women already spend 8 times more on caring activities than men. But during COVID-19, men are reporting, and self-reporting, I should say, spending 65% more of their time. Now, whether, if you only ever spend half an hour, then you're spending 45 minutes, on care. So it depends what your basis is. It's not to say though that, we know, and I think it's very important not to draw on or think about, absent men. We know that men play multiple roles. whether they're
Yes.
as fathers, as brothers, as uncles, as grandfathers. And so a lot of financial flows of money and financial support may be, happening within families, which, and spread thinly across many people. And so it's not always highlighted in kind of survey findings that we see it's going directly to children or directly to one particular person. But in that article, you're right, particularly for people who are self-employed or in informal employment or insecure employment and precarious work, the ability for them to fulfill their responsibilities, particularly in terms of maintenance, has been apparent. And I'm currently waiting for more results to come back on that, to see how maintenance payments are, changing in this current moment.
And let's talk about Zoleka's situation. That is not an unusual situation because we've seen many households in South Africa, just like the old age grant receiving household, many of them are also headed by women. Let's discuss the inequalities that women face, women like Zoleka.
Yeah, I suppose when we think about inequality, we first have to think about inequalities across households. So the one thing is, Zoleka is a Black South African woman. She is roughly 50 years old. So compared to other ethnic groups, or, she is already carrying the responsibility. I should say to the listeners, Zolek, for those who haven't read it, Zolek is a teacher. Zolek is a teacher and lives multi-generational household and is providing financial provision for not only her own child, but her niece and nephews, and also for older aunts and uncles who both live in the household but also who live elsewhere, which, as you say, is not unusual at all. So the demands and the responsibility that Zoleka carries have a racialized significance. So the extent of people in her wider family living in poverty that require them to seek support from Zoleka being a person who has secure employment and income, is different to wealthier families, white wealthier families, or families in different class positions. And we know that has this significant historical construction. So that's the first thing. The second thing is that Zoleka takes, as a woman, as a Black South African woman, carries that responsibility in ways that other men in that wider family are not. So she, as I said to you, she is carrying the financial responsibility for many, but she's also carrying the practical responsibility of looking after younger kids. But she's also drawing on the support of an auntie who is a cousin of hers, who does the day-to-day kind of hands-on caring of the younger children. Who's not playing, the people like Zoleka, though, are not necessarily being well supported by the state. Zoleka, as you know in the example, is looking after one of her nieces who's living with severe disabilities. And Zoleka in the last, I think it was 2 or 3 years, has been trying to get state support. So not just in the form of cash, not a disability grant per se, but actually practical support, practical care support, because the level of care that's required in the household, in addition to the level of care that's required for this particular niece, is significant, and it's difficult to manage. And so we can see here that the state, in its limited capacity to provide, physical care for vulnerable people, whether they're children, whether they're people living with disabilities, or whether, the people, older persons, we see that Zoleka is carrying this responsibility more than anyone else. So to get back to the actual question, the inequalities that she encounters as an individual are racialized in the first instance, gendered significantly as well.
And that is, like I mentioned earlier, a usual situation. This is what we find in any South African household. So what needs to be done going forward? I know that the women-headed households and old age-headed households will always be the norm in South Africa, but obviously there can be something done to ease these challenges that they face.
Yeah, I think it's a great question because we want to look to, not necessarily like solutions, but ways of assisting, and I think there are multiple forms of possible solutions that could be offered. So there's both practical, so care provision type solutions. So when we think about women who work in informal employment or even formal employment, the ability to access ECDs and creches that are affordable and accessible in terms of distance, but also of good quality is a key resource that is needed so that women can go out to work and be comfortable at work, knowing that their child is well cared for and is obtaining the education, that a child needs. So that's one thing. So there's, a higher, not just rollout, but it's the quality that is important when we look at ECDs. We also see that, in the COVID-19 relief grants that were offered, we see women are absent. Women as carers, I should say, were largely ignored in the sense of 2/3 of the COVID-19 grant, the social relief distress grant, were allocated or given out to men. And you have to ask a question, why is that? It's because people who were already receiving social grants were not allowed, didn't qualify, or were not eligible to apply for the specific grant. And here we see women being punished as primary caregivers, whether they are mothers, whether they are grandmothers, but not yet old age grant recipients. So there's a huge portion of the population, let's say specifically between 40 and 60, who may be grandmothers or mothers, but are in key primary caregiving roles and are not being recognized by the state in this particular grant. And that's just an indication of the invisibility of care and caregivers in our society. And that's one thing that radically has to change. So as I said, there's a number of ways of doing that. So if we think about informal economy, we think workplaces should be safer to make sure that women can work at different times of the day and get to work at different times of the day. We think of creches, as I've alluded to, that are accessible and close to work or home, and we think of, but we also think about recognizing this extensive care work that women specifically, and I should say particularly that Black working class South African women are carrying more, where other members and groups in society can afford to turn to the market to pay for creches that are good quality, that are accessible, or schools, for example. So there are some of the things that we've been doing. As I mentioned, I personally believe that the old age grant should be extended in the case of a COVID-19 related death in a household, or there should be some mechanism in place that recognizes that and allows for it. And I could go on. There are others. One huge problem we saw was the supplement for the child support grant being allocated to the primary caregiver, despite the number of children that are being looked after. And here we see this is a real problem. We think about the cost of caring for children and the cost of food and the cost of just rent, electricity, food, and living costs. The more children you have, the more expensive it is. It's, it doesn't take an economist to figure that out. So we're punishing people who are looking after, who are the primary caregivers of more children. And again, and that's not supporting care. It's not supporting children. So whilst we have a large and a very vocal debate going on about schools opening, schools closing, we're also not hearing it's not the debate about the supplement and there has been a small debate, or there is a debate, but it's not as vocal as the debate about schools opening and closing. It's not a competition either. But what I'm saying is that really punishes caregivers who are looking after multiple children.
And at the end of the day, it's the privileged who will benefit from this entire situation and what's going to happen to the primary caregivers of the poor. I mean, if it comes down to self-isolation, if one has contracted the disease, the primary caregiver, what happens to them when they have to look after small kids and they have to also isolate, and becomes a very, very challenging situation. But we're going to leave for now. Dr. Elena, thank you so much for your time.
Thanks, Mariam. Thank you. Bye-bye.
Have a wonderful day. Bye-bye.
You too.
It was Dr. Elena Moore, talking to us about her research paper, Women-Headed Households with COVID-19. If you have any comments regarding that topic or any questions, you may leave them in the comment section or send them to our WhatsApp line. The number is 061-766-0355. It is 11:32. Do stay with us. We will be right back.